Welcome to the Project Management for Nurses series on building a quality improvement project charter. Part 3 continues the development of the Healthcare Quality Improvement Project Charter, and viewers will examine 3 methods of evaluating and measuring the success of the project to meet outcomes. Andrew, your project expected outcomes and benefits were well received by the clinic board last night. They would like to know how you will be evaluating for these outcomes. Since the mission of this FQHC clinic is to be a health provider source for all community members and we need to be financially stable to perform this. The board also want to know how we are making sure other clinic clients are not losing access to our providers due to the use of the certified nurse midwife and a couple of our nurses. We need to make sure our income generation is not reduced.
Thanks for the feedback, Juanita, and the questions from the board. I am working on how the project will be measured and evaluated today. I can have a draft of the measurements to you later this afternoon. In a couple of weeks, I will be working with Jonas, our clinic IT specialist, to determine how to collect and analyze the data.
Thanks. I look forward to receiving this new information for the project charter.
Okay. I need to determine 3 sets of project measurements: outcome measures, process measures, and balancing measures. The outcome measures will evaluate the expected outcomes listed for the project. 2 of these outcomes incorporate the National Committee for Quality Assurance HEDIS measures. Over the first year of the project, of the number of pregnant Hispanic women enrolled at the FQHC as clients, 75% had a prenatal care visit in the first trimester. Over the first year of the project, of the number of pregnant Hispanic women enrolled at the FQHC as clients, 75% of postpartum women had a phone call from a nurse 1 week after delivery, an office visit on or before 28 days postpartum, and a final comprehensive postpartum visit no later than 84 days after delivery. Over the first year of the project, 60% of Hispanic women enrolled in the Baby Talk series completed the program. Over the first year of the project, with nutrition information provided in the Familias Sanas model and support from the project team, complications to mother and infant from hypertension and diabetes are reduced to 15% from baseline level. The process measures evaluate whether the project is performing as planned to meet the outcomes. The project team will review the following measurements monthly. 1. The number of contacts of the community health worker with pregnant and postpartum Hispanic women in the areas they live. 2. The number of visits by the pregnant and postpartum Hispanic women identified by the community health worker with the nurses and certified nurse midwife in the clinic setting. 3. The number of phone calls made by nurses to Hispanic women who are 1 week post-delivery. 4. The number of Hispanic women who register and attend the Baby Talk sessions. 5. The number of community referrals nurses are making to reduce barriers resulting in health disparities to improve maternal and newborn outcomes. Finally, we need to evaluate balancing measures. This information lets us know whether the quality improvement project is introducing problems somewhere else in the organization. The main concern from the clinic director and clinic board is to maintain the access to providers for clients outside of the project. This data will be reviewed on a weekly basis to see if a scheduling issue is related to the project, and what adjustments need to be made to clinic scheduling. 1. Number of clinic visits that run overtime due to pregnancy and postnatal complications for Hispanic women included in the Quality Improvement Project. 2. Number of clinic visits where the Hispanic woman did not attend scheduled pregnancy or postnatal visit. 3. Number of clinic visit changes for Hispanic women included in the Quality Improvement Project due to scheduling problems with the community health worker, nurse, and certified nurse midwife. I will give these measurements to Juanita to review. She can determine if there are any other balancing measures that she wants monitored to evaluate issues that influence the clinic's management.
This concludes Part 3 of the Project Management for Nurses series on building a quality improvement project charter. In this video, the viewer examined how to evaluate and measure the quality improvement project. Part 4 will determine how to develop successful project teams and stakeholder management.